So this is what we're talking about, preservation deep plane facelift. And I'm going to first talk about what a deep plane facelift is and how it is a little different than other techniques of facelifting. And then I'll spend some time explaining the differences between what does it mean to do a preservation deep plane facelift versus a regular deep plane facelift. And then we'll talk about some common questions that I get and then go to your questions. A little bit about me. I'm a facial plastic surgeon here at Westlake Dermatology at the Lamar Central office. This is a long list of sort of what I've done in my professional career. I've been in practice 30 years and I've been at the leadership level of facial plastic surgery essentially for the last 25 years. I've done a lot of teaching, writing, research, and when I was in New York, and I've been in Austin since 2015, where I've really dedicated on clinical practice. So this deep plane facelift type of surgery, I've been actually doing since about the year 2000. It was first reported in the literature in 1990 by Sam Hamra, from a plastic surgeon in Dallas. But it's been updated, modified over the years, and lately it's been really significantly modified with some steps that have changed the surgery for the better, in my opinion, and that's what the preservation deep plane facelift is all about. So what happens as we get older? Well, their skin changes. You can see in this representative patient a sort of color, texture issues with skin. We have brow descent that causes hooding or heaviness of the upper eyelids. In addition, we have upper eyelid skin excess that develops as we get older. Lower eyelids can get baggy and make you look tired. And then this fat is demarcated by this ligament that inserts on the bone so it can't go any further and creates this dark shadow or tear trough. Facial fat, bony loss, facial fat descent and loss, and laxity of the ligaments in the face are what causes the sagging. And so in the face, that ligament that gets weak is called the SMAS, which is the subcutaneous musculoaponeurotic system. It's essentially a fibromuscular layer that weakens over time. Importantly, the same layer extends into the neck but changes names to platysma. And platysma is the muscle of the neck. It's muscular, not fascia at all, but muscle, and that gets weak. But it's the same layer that extends all the way from the collarbone all the way up to the cheekbone. And that's the layer that descends and gets weak. Now, why is that important? Well, it's important because if we can't free up this layer, this SMAS layer, which in this diagram is indicated by this number 3 layer, if we can't free up this layer adequately and move it, then we don't get a lasting result. And so the older style SMAS facelifts essentially raise the skin and maybe extend it a little bit underneath this number 3 layer, the SMAS, and released it slightly and then pulled back on it. It gives a good result on the table and it makes things look good for about 5 years, but then we start to get regression and stretch back. The SMAS lift also doesn't do anything for midface. It only works well for the muscle of the neck, the platysma, and the jawline. So the older style lifts ignored the midface, or today surgeons are using fat transfer and fillers to try to make up for the fact that they can't lift the fat that's in the midface up to where it was. Now the deep plane lift, on the other hand, goes underneath the SMAS facelift layer, and it goes deep all the way forward, and it releases ligaments. In this diagram, you see this little fibrous ligament here. That's called a retaining ligament, and it goes from deep structures all the way up to the skin. And if the retaining ligaments cannot be released adequately, then there is no movement. We can pull, but we can't move. It's like trying to pull a sheet that's tucked in at the bottom of the bed. If you pull on the sheet, it's not going to, you can flatten out the wrinkles, but the sheet won't move. It's tucked in. You got to untuck it, release it to get it to move. And so that's what we do with a deep plane face and neck lift. So here's a picture of these retaining ligaments. They're important ones throughout the face and also into the neck. It's not indicated here. And again, deep plane facelift, it's important to release so we can move this whole layer up to where it was 15 years ago. And the release also allows, by moving this whole layer, so remember this layer starts here and goes all the way into the neck. So the release has to be here and all the way in the neck, underneath the muscle of the platysma, underneath it, so that the whole layer can slide. And so a properly done deep plane facelift also makes the neck look better because it allows for a better redistribution of the weakness that's occurred in the platysma. So I'm going to show you some examples in my own patients for deep plane facelifting. Here's that lady that we saw at the beginning of the talk, and she had a deep plane face and neck lift, an endoscopic brow lift, upper and lower blepharoplasty, and a peel around the eyes. Now, we're not going to focus on the upper face today, but the deep plane facelift allows for certain things. So the release occurs all the way forward to about this line. So by releasing and redistributing, we get improvement of nasolabial folds. We get elevation of cheek fat. So now we have volume in the upper face that we didn't have before. There's been no fat transfer and no fillers in this patient. It's all just elevation of her natural deep fat that had fallen with this mass. And then, of course, we get improvement of this bunching from the laxity of this mass along the jawline that's stuck here. So we release that area and redistribute it backward, and now we get smoothing in that area. And the neck is also looks better. We'll see when she smiles, all these vertical lines that she has because of laxity in this mass improve. They're not completely gone. She still can smile, but there's smoothing by redistribution of this mass up and back to where it was. Now, you see with the eyelids, we still have those lines, but they're not as deep. And that's the eyelid surgery we talked about and the endobrow lift. Oblique views, I love the oblique views because they're kind of the views that the world sees. And she has really nice elevation of cheek volume. She has redefinition of her cheekbone that she lost over time. All this laxity is much improved, and the neckline looks much better. When she smiles, you see the improvement again of these vertical laxity lines from the mass bunching. And when she looks down, all that laxity of the skin is not because we've pulled on the skin. We've redistributed the platysma up and back, and then we just trim off what's extra. The incisions, they start up here in the hairline, come around to the top of the ear, in front of the helix, behind this little bump called the tragus, around the earlobe to the back and along the hairline. This gives us access to neck and face. Another patient, younger, who had a deep plane facelift, upper and lower blepharoplasty, and this time a deeper peel around the eyes because of the deeper lines that she had around her eyes. But let's draw attention to what's going on in the midface. She has a really nice redistribution of the midface. She doesn't look overdone. There's a natural redefinition of the jawline and improvement of the neckline. When she smiles, again, some of the improvement that we see in facial fat distribution, jawline looks better, nothing looks weird or overdone, and she has, importantly, a re-elongation of the jawline. When we get older, the jawline looks short. It's because the jowl comes down. The jowl is part of this mass laxity in this patient. So we lose definition in the back part of the jawline because of laxity, and the gel makes the jawline look real short. Here, we've restored a really beautiful long jawline, which is what she had when she was younger. Again, significant improvement in laxity of her neck area. But also you can even see it here in the mid-face. This is an older, heavier patient, and we just did a deep plane facelift and chin implant. We'll talk about the chin implant, a profile view a little bit, but with the deep plane facelift, a smoothing and elevation of her cheek fat, a smoothing of the jowling, and improvement of the heaviness of her neck. So redefinition of her jawline. Really nice improvement of the jaw neckline. But when a patient loses chin volume or never had good chin volume, then we cheat by putting a little implant in here. And I say cheat because the implant allows me to extend the jaw neckline further forward and give better support to this area. The deep plane neck lift actually raises and sets back the hyoid bone. The hyoid bone is what is a bone here that prevents the platysma from going back beyond a certain area. So by extending the chin, but also moving the hyoid back, we get a really nice redistribution and improvement of the cervical mental angle, the jaw neckline. Laxity is improved. Everything looks supernatural. Incisions are invisible, and she looks better. Here's a patient after significant weight loss, and all we did in this patient is a deep plane facelift. So we'll see improvement of all the laxity that she had in her skin, but not by pulling on the skin, by freeing up, releasing, and redistributing this mass backwards. Smile, you see a lot of improvement of her multiple vertical lines. A really beautiful redefinition of her jawline and a setback of the hyoid so that the platysma redrapes beautifully and everything looks just natural. Nothing overdone, nothing overpulled. A lot of laxity improved. The same kind of thing. Laxity is improved and she looks refreshed. Importantly, volume, again, no fat transfer. So this is volume elevation in her midface, recreating definition in her cheekbone. Here, the volume was here. We moved it up and back to create definition where she had lost it. So now that we've covered what a deep plane facelift can do, let's talk about what a preservation deep plane facelift is. So a deep plane facelift essentially creates elevation of the skin in front of the ear by about 1.5 to 2 inches. What preservation means is less elevation of skin, so that instead of having to elevate a lot of skin, we're elevating much less skin. But the release in the deep plane is the same. So the only difference between a deep plane facelift and a preservation deep plane facelift is less skin elevation. Why is that important? Well, if we can maintain the attachment between the deeper structures of the face and the skin for a longer distance, then we get improved blood flow to the skin that's left behind, and we get a more rapid diminution or reduction of swelling because those attachments haven't been released. Wherever the skin is elevated alone, there's more swelling. When we elevate the skin and deep plane together, there's much less swelling. So this allows for much less swelling in the recovery phase of healing. So the other difference is that in the deep plane facelift, the full neck skin was typically elevated. So we elevated all the skin across the whole neck. This was to allow for redistribution of the skin nicely. But what we found is that by limiting the neck elevation to only where it's required for access to the deep plane, then we can keep the skin attached for a longer distance, and we get a much more rapid recovery and actually a sharper jawline in many patients. Because less skin is elevated, drains can be, the use of drains can be shortened. Many surgeons have stopped using drains with preservation deep plane facelift. I still do use drains because for me, drains serve an important role of, again, helping to reduce swelling more rapidly in the surgical area. But the time for the drains has shortened by about half. The release, though, in the deep plane, the extended deep plane release in the midface and in the neck is the same. Both procedures are exactly the same. Deep plane work, it's the skin work that is reduced. So this is an example of, in this patient of mine, where I elevated her skin. So the skin is elevated in front of the ear by about 2 inches, and then comes down and is elevated along the entire neck, skin only. And then the deep plane is elevated all the way forward here and all the way underneath this area. With a preservation lift, the skin elevation is shorter in front of the ear, and it's shorter underneath the chin area. So there's an island of unelevated skin that allows for more better definition along when it's redraped, and also less swelling. This is a picture from a recent article. Actually, it was published in December 2024, so really very recent. And it was put together by a bunch of my colleagues who do a lot of this deep plane surgery. And you'll see this is the mark. This is where the deep plane skin elevation is in green, the older style, and this is where after the lift, where the skin needs to sort of re-stick down. Because there's so much skin elevation in the neck, that's why drains needed to be used. Now, in the preservation lift, there's less skin elevated. The green is where the skin is still elevated, though, in order for access, and then the green here. And then once the lift is complete, this is where the residual skin elevation is still. So my drains typically come down into this area that still the skin has been elevated, and then I make a little tunnel through. The drains are a little thin, so we don't need it. It's just a little 1/4 inch type tunnel into this area, so we can drain this area underneath the neck. That's many people don't use drains now because they'll do things like use sutures through the skin and into the deep tissue. These are called hemostatic nets in order to prevent the need for drains. Hemostatic nets, in my opinion, aren't needed. And if we can use a drain for a couple of days, you don't need a hemostatic net, and it's a little bit easier for patients to deal with. So some common questions regarding deep plane facelifts. So how long does an extended preservation deep plane facelift take? And it's 6 hours. In my hands, it's pretty reliably between patient 6 hours. It's a lot of surgery, and we want to be careful to get it done as well as we can. What kind of anesthesia do we use? Well, for that 6-hour period, we found that IV sedation by me is very, very effective. So no breathing tube placed, no additional anesthesia fees needed. It's a faster recovery from anesthesia, and I think a little bit less bleeding and bruising. But you will be asleep. It's not that you're awake. You can think of this as twilight anesthesia. Patients don't have unpleasant memories of anything. The limit for this type of anesthesia is around 6 hours. It can be extended a little longer in certain patients, but if it's longer than 6 hours, we really need to consider either breaking up the procedure into two. Say we want to do a brow lift and brow lift and eyes at the same time. Well, now that's a 9-hour operation. Frankly, I don't know that that's great for anyone. So we would break that up. We do a facelift first or second, and then do the other procedure as a separate surgery. Wow, I'm scared I'll feel pain. Well, you're not going to remember feeling anything. Everyone comes out of surgery without any memory of pain, and post-op pain routinely most patients don't need narcotics. Patients that do, everyone's pain threshold is different. We give a prescription for narcotic if you need it, but we manage pain typically with Celebrex, which is a non-steroidal like ibuprofen that does not cause bleeding. And once the big bulky dressing comes off that's placed overnight, you can ice as well. But if you do need, so most patients don't need narcotics. The ones that do, it's really just for the first night or two, since pain is always worse at night. How can I heal faster? Well, we'll give you extensive information on how to heal faster at your preoperative visit. We have all kinds of dietary recommendations and supplements and things like lymphatic massage that can help. How long will the results last? I wrote 15 years here because, frankly, I've been doing the surgery for about 25 years and have never had to do a repeat deep plane facelift in anyone. Do you use drains? Yes, we talked about that. 2 drains, 1 on each side. It's really just to ensure that no seroma forms. That's fluid underneath the skin. And it's really not needed in the deep plane areas of elevation. It's really just where the skin is elevated. They stay in for 2 or 3 days, like I said. After surgery, day 1 is an overnight wrap that we remove on day 1, the day after surgery, and then a smaller wrap we apply at day 3 or 4. The drains are out. Day 7, sutures are out, and we can do lymphatic massage after that. At 2 weeks, you can become more active, and we'll recommend that you can still use compression at night. It's really helpful. Patients like compression. Feels good to have something helping support the area, but you may return to work at 2 weeks. And the contraction phase of healing begins at 2 weeks. That means the little areas, as the body heals, there'll be contraction or collagen and elastin being laid down and then healing in. But the healing in process can cause little irregularities in some areas of the neck. And if that's the case, we recommend massage with various little massage auxiliary tools like a beauty bar. 3 weeks, lunch and dinner out with friends, increased activity as tolerated. By 2 months is when people can feel comfortable enough to take pictures, vacation, public speaking, and all that stuff. There's always numbness initially around the ears, and that is also in the central neck, and that begins to improve at 2 months. People are really exercising fully by then. And at 6 months, numbness and firmness has diminished to only small areas around the ears and in the neck, if at all. So, hopefully this sounds good to people. Devin, our cosmetic consultant, will contact all of you by email. Please don't be offended if you get an email from Devin. Mm-hmm. If you'd like to schedule a complimentary consult with Devin, you may do so by reaching out to her by email or by replying to the email. You can also schedule a consultation with Devin online. You can also, if you prefer, schedule a paid consultation with me by calling my office number here at Lamar Central or by booking online. You all might want to, if you have, you want to take a screenshot of this or take a picture so you have Devin's work email in case you'd like to contact her. It's devinw@westlakedermatology.com. We are offering a special offer for everyone who's listening today where you can benefit $1,000 off the procedure. If you'd like to take advantage of that, please reply to Devin's email, and then you'll receive a quote with $1,000 off. And if you'd like to guarantee that $1,000 off, you need to put a $500 deposit down within 30 days. Quotes are good for a year, meaning you have to have surgery within a year for it to still be valid. And the deposit goes towards the price of surgery, obviously. And schedule your surgery by contacting Devin when you're ready. And of course, we would love to see you in person whenever you're ready. So let's see. Great, cool. All right. So hopefully that was somewhat helpful. I love the idea of preservation facelift. I've been incorporating portions of this into my practice. I heard about it in the last 6 months, really, from colleagues that have been doing it for about a year. So it's really pretty new. Even the the busiest deep plane facelift surgeons in the world have really only started doing this preservation technique in the past year, although a very good friend of mine, Neil Gordon in Connecticut, is one of the founders of this way of thinking and has progressed towards what we are now doing. So if you'd like to, I know that Devin, we have some questions. Would you like to ask some of those for me?
Yeah, we can go through those. So we have a few here. The first one I see is if there is a recommended age range for the deep plane face and neck lift.
Yeah, so that's a really good question. I'll start by saying that it's not really age related. It has to do with more what's going on anatomically. So if you're seeing things that you don't like along your jawline, like jowling, and or excess heaviness in the neck, and or falling down of your midface, then you're probably a candidate for a deep plane face and neck lift. Now, if you have no jowling, but still have stuff going on in the central neck, then you're actually a candidate for the first step of a deep plane face and neck lift, which is a deep anterior neck lift, where we're doing the deep plane work just in the midline. And by doing that, we can have the platysma remove whatever is preventing the platysma from rising and creating a nice jaw neckline, and close. So it's it's an operation only of the central neck. Then but if you have jowls, then you are no longer a candidate just for that, and because we have to redistribute things back up and back. Now, my typical age ranges are typically mid 40s and older. And by older, I mean I've operated on 79-year-olds and 80-year-olds as long as they're healthy. But so that's a typical age range. But the hallmark isn't age, it's what's going on anatomically.
All right, next question. I have a question about the anesthesia used, if it's similar to propofol.
Great question. So it is similar, although propofol in particular must be administered in my opinion, should be administered by a nurse anesthetist. That's an extra cost. So we don't use propofol. We use other medications. The main one that keeps people sleeping and comfortable is Precedex, which is another type of medication that's short acting, similar to propofol in some of its properties, but easier to manage without having a nurse anesthetist present.
All right. And then how long does it take to heal completely? Do you have any progression pictures?
No, I don't have any pictures. I don't typically take sort of in between pictures. I probably should, but I just don't. But like I said in my slides, I guess it depends on what you mean by completely. So most people are out and about in their lives by 3 weeks. But remember, we're doing a lot of muscle work. We're freeing up the muscles of the neck from underneath and moving them. We're moving the fibromuscular regions of the face. So to expect to do like a full workout too soon isn't realistic because those muscles have to sort of heal in. By 3 weeks, most people start increasing the activity, and by 2 months, you're doing a full workout. But it takes that long for sort of the body to heal in. Full healing after any surgery, we say takes a year. And that's because there's contraction that starts at 2 weeks and goes on for 4 months. And then there's reorganization of the wound where things soften and settle. So I'd say it takes a full year for really full healing of in a complete way, but most people won't notice much of anything after the first month.
All right. Does the deep plane face and neck lift treat the décolleté area?
No. So remember that layer ends at the collarbone. And so the deep plane face and neck lift treats sort of from the lowest crease in the neck, the lowest horizontal crease in the neck up to the cheekbone, that area. Décolleté is in my opinion best treated with lasers and not surgery.
All right. Can you describe where the scars are?
Yes. So the incisions, there's one incision underneath the chin that goes essentially where I'm showing you here. And then the incisions, the rest of the incisions start in front of right in the hairline. They come around your hairline, so we preserve the hairline. Hair will grow right through the incision. Then it comes in front of the ear, behind the tragus, around the earlobe, to the back of the ear and along the hairline. So along the hairline to about here. So that gives us access to neck and face. These incisions honestly heal as well as any incision can heal. You should not be able to find them. The trick with the incisions is that I don't pull on the skin at all. All the redistribution of the force is in the deep plane. The skin is whatever's extra, just trim off. There's no pulling of the skin. So incisions heal really beautifully. Hard to find them once they're all healed.
Perfect. Can this procedure be done with a deep plane face and neck lift from 14 years ago, a prior one? Sorry.
Great question. So preservation deep plane facelift is actually in my opinion, the best procedure to do if you've had a previous facelift of any kind. So 14 years ago, if you've lost correction from 14 years ago, then the preservation deep plane lift will allow me to keep more of the skin intact, so blood flow is maintained, and so less chance of problems with healing in the skin area, which is the main area that we worry about healing, is in the skin in front of the ear and behind the ear. And then as long as we can get an adequate full release, then you'll get a really nice improvement. Previous surgery will have created scar. And so as long as the scar is thin and normal, but if you have thicker scar in the surgical areas, then it may limit how much I can do safely. I'd rather do less and be safe for you than try to push the envelope and do something a little bit too much like a cowboy. So that keeps people safe, keeps my results really natural looking, and keeps everyone happy.
All right. Should you get your upper and lower eyes done before this surgery?
That's a great question. And the answer is it really depends on what bothers you. So I always advise patients, do what bothers you first. It doesn't really matter if you have a lot of stuff here, but your eyes are killing you, you really hate the way they look, then do that first. If this is bothering you more, but you have big bags, who cares? Do this first. I've done deep plane facelifts on patients with huge bags, and they're like, the bags aren't what's bothering me. So, it's not a great before and after because they still have bags, but patients are happy, and that's really all I care about.
All right. Is the deep anterior neck lift the same duration of healing as the deep plane facelift?
No. Deep anterior neck lift is very limited surgery. It's really just here. And so now we'll often do some laser assisted lipo or something to help to carve out the jawline, or maybe take care of some minor jowling. Sometimes we'll do buccal fat extractions at the same time if there's buccal fat that's creating some heaviness here. But even if we do all of that, it's about half as much healing. So incision incision stitches come out at a week, still drains for 2 or 3 days, um, but you're sort of after the stitches are out at a week, most people are back into their lives.
What kind of health problems would disqualify a patient from undergoing this procedure?
Great question. So, um, if you have respiratory issues that like COPD or emphysema, so that you can't oxygenate well, then that may limit your ability to do this surgery. If you have heart issues that would cause and or arrhythmias that might get worsened by anesthesia, then you may or may not be able to do this surgery. Um, the essentially, if you have health issues, you ought to uh, tell your doctor that take care of those health issues, that you're thinking about facelifting, that you're thinking about a 6-hour surgery, and see what they say. And if they think that you are fine, I mean, I'm not an expert with those things, so I'll go by whatever recommendation the experts have for us.
Do you ever find filler in a person's face, and does it change how you do your lift?
There is a lot about the evils of filler online now, and some of my very good friends who do a lot of facelifting are saying don't ever get filler, and it's just nonsense. I'm sorry, but it depends on the filler. So most fillers are hyaluronic acid fillers like Juvederm and Restylane, that kind of thing. And those fillers dissolve to carbon dioxide and water and don't leave back any significant scarring. So as long as there's no scar tissue in the tissues, then filler is never an issue. Yes, I find filler, but it's never an issue. Sculptura and other fillers that create volume by creating inflammation. That's how Sculptura works. It creates volume by creating a collagen response in the body. Those fillers can leave behind scarring that makes the surgery more challenging for the surgeon. But frankly, it never obliterates the planes. In other words, doesn't never makes things so bad that we can't do the surgery well. It's just one more little thing that we have to pay attention to. It might take a little longer to get through everything safely, but we see it with some frequency and it's never really a big issue. If I were advising patients who are thinking about facelifting what filler to get, I'd probably recommend a hyaluronic acid filler and not Sculptra.
Great. Can you get a deep plane, face and neck lift, and the lower eyelids done at the same time?
Yes.
Perfect. And then I did have a few questions about cost, but I'm happy to go over that individually too.
Yeah, perfect. All right, you all. Well, thank you for your attention. I hope it's been helpful for everyone. And I look forward to meeting some of you in person in the near future.
Awesome. Thank you.